This section should give a short introduction to the ABC handling procedures, CPR, unconsciousness and the recovery position, examining the casualty, and mental first aid. No matter what kind of injury, incident or accident, the ABC handling procedure is of utmost importance. In assessing the casualty, these rules are to be followed in order to secure the vital functions of the casualty. If these functions are not in order, the casualty may die. To survive, there must be a minimum of vital functions. An unconscious casualty's airways may become narrowed or blocked. This makes breathing difficult and noisy, or completely impossible. A common reason for this is that muscular control in the throat is lost, which allows the tongue to fall back and block the airway. If there is no neck injury, and having inspected the mouth for any obvious obstruction, there are 3 maneuvers used to relieve upper airway obstruction. These are head tilt, chin lift, and jaw thrust. To perform a head tilt and chin lift, place one hand on the patient's forehead and tilt the head gently back. Place the fingertips of your other hand under the point of the patient's chin and gently lift the chin back. This maneuver should only be performed if there is no concern regarding a neck injury. If there is any doubt, the jaw thrust maneuver only can be performed. Identify the angle of the jaw and, with the index and other fingers applied behind it, apply a steady pressure to lift the jaw forward. This avoids any neck extension. Check the casualty's breathing for up to 10 seconds by looking for chest movement, listening for sounds of breathing, and feeling for breath on your cheek. If the patient is not breathing, ask someone to call for help. If you are on your own, you may need to do this yourself, leaving the patient briefly. Then start CPR. Give 30 chest compressions at a rate of 100 per minute. After 30 compressions, give 2 rescue breaths. Continue with compressions and rescue breaths at a ratio of 30:2. Only stop when help arrives or you become exhausted. If the casualty is breathing, place him in the recovery position and call for help. Remember to reassess the patient regularly for continued breathing. Remember the 3 key words: look, listen, and feel. If the heart stops, you can apply chest compressions to force blood through the heart and around the body. You must combine these with artificial ventilation so that the blood is oxygenated. When referring to bleeding in first aid and emergency medicine, it is defined as serious and life-threatening bleeding, in need of immediate treatment and on-site medical care. An adult person's blood volume is approximately 7% of the person's body weight. In children, the percentage is slightly higher. In an adult, blood loss of more than 40%, or approximately 2 litres, would in any case be fatal. Bleeding injuries are divided into 2 major categories: external, which is readily visible, and internal, which is much more difficult to diagnose. We will concentrate on external bleeding. To treat external bleeding, you need to place direct pressure immediately upon the wound with your hand or finger. If possible, elevate the injury. Lie the patient down. Place a pressure bandage directly over the bleeding. Prevent circulatory failure. Monitor the patient. blood is oxygenated by breathing and is circulated around the body by the beating of the heart. If the body's natural mechanisms of breathing and heartbeat break down, it is essential to resuscitate the casualty by taking over the ventilation and circulation through artificial ventilation and chest compressions respectively. This restores the supply of oxygen to the brain. If the heart has stopped beating, you will have to provide artificial circulation by means of chest compressions. To be of any use, chest compressions must always be combined with artificial ventilation. This process is known as cardiopulmonary resuscitation, or CPR for short. If both you and your helper are trained to administer CPR, you can do so together. You should always give both artificial ventilation and carry out chest compressions at about 100 compressions per minute. Give 2 breaths of mouth-to-mouth ventilation, alternated with 30 chest compressions. Make sure it is safe to approach the patient. Check patient responsiveness. Call for help. Open the airway. If the patient is not breathing, start CPR. Tilt the head back to open the airway and check for breathing. If the casualty isn't breathing, you will have to start artificial ventilation. First, you need to give 30 compressions. Breathe for the casualty. Look into the mouth and remove any obvious obstruction. If the casualty is not breathing, then start compressions. Kneel by their side. Place the heel of one hand in the center of their chest and the heel of the second hand on top of the first. Interlock the fingers of your hands. Position yourself vertically above the patient and with your arms straight, press down on the breastbone. After each compression, release all the pressure on the chest without losing contact between your hands and the breastbone. Repeat at a rate of 100 per minute. After 30 compressions, open the airway using the head tilt chin lift method or the jaw thrust and give 2 rescue breaths. Having done this, continue with chest compressions and rescue breaths at a ratio of 30 to 2. You should check that the patient's chest rises when you give rescue breaths. If this is not happening, check the mouth for foreign bodies and check that there is adequate head tilt and jaw thrust. Do not attempt more than 2 breaths before returning to compressions. Only stop CPR if the patient starts to breathe spontaneously, or if help arrives, or if you become exhausted and unable to carry on. Place the middle finger of your lower hand over the point where the lowermost ribs meet the breastbone. Place the heel of your other hand on the breastbone. Slide it down to meet your index finger. Lean well over the casualty with your arms straight. Press down vertically on the breastbone and depress it by approximately 4 to 5 centimetres. Release the pressure without removing your hands. Compress the chest 30 times, aiming for about 100 compressions per minute. Children and babies require a slightly different treatment than adults. Check response. Open airway. Check breathing. Breathe for the casualty. Gently blow into the mouth until the chest rises. On babies under 1 year, we usually blow both into the casualty's mouth and nose. Commence CPR. With very young children, give 5 breaths of artificial ventilation before starting CPR. Use 2 fingers for a child under 1 year old to compress the chest by 1/3, and do this 30 times. Then give 2 breaths alternated with 30 chest compressions. If the child is 8 years or over, treat as for an adult. Unconsciousness results from an interruption of the brain's normal activity. Whatever the cause, follow these 3 rules. Ensure that the airway is clear. Keep checking response level. Examine the casualty thoroughly. When examining and treating an unconscious casualty, your aim is to maintain an open airway, to assess and record the level of response, to treat any associated injuries, to arrange, if necessary, urgent removal to hospital, to gather and retain any circumstantial evidence of the cause of the condition. Do not attempt to give an unconscious casualty anything by mouth. Do not move the casualty unnecessarily because of the possibility of spinal injury. Never try to make an unconscious person sit or stand upright. Do not leave an unconscious casualty unattended at any time. An unconscious casualty who is breathing should be placed in the recovery position. This position prevents the tongue from blocking the throat, and because the head is lower than the rest of the body, liquids can drain from the mouth, reducing the risk of the casualty inhaling stomach contents. The head, neck and back are kept aligned, while the bent limbs keep the body propped in a comfortable and secure position. If you are forced to leave an unconscious casualty unattended, he or she can safely be left in the recovery position while you get help. Kneel beside the casualty. Before turning him, remove any fragile or bulky objects from his pockets. Open his airway by tilting the head and lifting the chin. Straighten his legs. Place the arm nearest to you at right angles to the casualty's body. Bring the arm furthest from you across the chest and place the back of the casualty's hand against his opposite cheek. With your other hand, pull up the far leg just above the knee, keeping the foot flat on the ground. Keeping the casualty's hand pressed against his cheek, pull on the upper leg to roll the casualty towards you and on his side. If necessary, use your knees to support the casualty so that he is prevented from rolling too far forwards. Tilt the head back to ensure the airway remains open. If necessary, adjust the hand under the cheek and adjust the upper leg so that both the hip and the knee are bent at right angles. Dial for an ambulance. Monitor and record breathing and pulse every 10 minutes until help arrives. A detailed examination of the casualty should be undertaken only after taking any vital action needed. You may need to move or remove clothing, but ensure that at every stage of your examination you do not move the casualty more than is absolutely necessary. Always start at the head and work down. The top-to-toe routine is both easily remembered and thorough. Examine the casualty in the following order: head and neck, shoulders and breast, back, hips and abdomen, thighs, legs and feet, and arms. There are several first aid kits on board a vessel. Normally they are located on the bridge, in the galley, in the engine control room, in each lifeboat. The contents of these first aid kits are regulated according to international and national requirements. Radio Medico is medical assistance to seamen abroad. Under international conventions, countries give radio-medical advice to ships at sea. In the UK, ships call the Coast Guard. And also, medical evacuation can be arranged by air. If a person gets badly injured on board and the management on board must request medical assistance from shore, they can contact a hospital through a radio station. Norwegian seamen, for example, can contact Haukeland Hospital through Rogaland Radio. The doctor on duty will have immediate access to rescue centres worldwide. Although the service is established to serve Norwegian vessels, requests from non-Norwegian clients will be honoured. Doctors require the following essential information. What are the symptoms and signs, and when did they occur? When did the symptoms or signs start? What was the very first complaint of the patient? What are the findings upon examination? General impression. Looks ill, looks well, consciousness, clear-minded, confused, unconscious, face colour, sweating, temperature, pulse, respiration rate. Every casualty needs to feel secure and in safe hands. You can create an air of confidence and assurance by being in control, both of yourself and the problem, acting calmly and logically, being gentle but firm with your hands, and speaking to the casualty kindly but purposefully. Talk to the casualty throughout your examination and treatment. Explain what you are going to do. Try to answer questions honestly to allay fears as best you can. If you do not know the answer, say so. Continue to reassure the casualty even when your treatment is complete. Find out about the next of kin, or anyone else who should be contacted about the incident. Ask if you can help to make arrangements so that any responsibilities the casualty may have, such as collecting a child from school, can be taken care of. Do not leave someone whom you believe may be dying. Continue to talk to the casualty and hold his or her hand. Never let the person feel alone.